Meantime, healthcare workers continue to demand more protections after a visiting nurse was killed last fall. Now lawmakers are looking at several bills that could provide more safety. NBC Connecticut political reporter Mike Savino joining us live from the Capitol with more. And Mike, what kinds of protections might we see?
Well, Amber, nurses say they want more training, better staffing, and a series of other changes so that they feel safer when they have to go into patients' homes. And they say that without these, more people are leaving the field.
We're not superheroes. We're not superhuman. You know, we have feelings. You know, we can be hurt.
Home health care workers say it's time for more protections. The death of visiting nurse Joyce Grayson, who was found dead in a patient's home, only highlighted a growing problem. Healthcare workers have been facing a rise in threats and violence since the start of the pandemic.
There was some moldy cheese or something, and I just threw it away because I didn't want them to eat it and get sick. And the family member was very upset with me and threatened to kill me.
Sherry Dayton is head of the state's largest nurses union. She says every home health care worker has their own story. Now Dayton's calling for more training and more staffing. That would allow nurses to work in teams when they're worried a patient poses a threat.
We want to make sure that they feel safe and have good livelihood and lifestyle.
Lawmakers agree. They've proposed several bills looking to provide more protections to home health care workers. Other changes would include better communication whenever a patient has a history of threats or violence. Healthcare providers say this builds on what they've been doing.
We think that that work just continues this year and looking for new opportunities.
Republicans are also on board, but they think other proposals need to be included. Police say Dayton was killed in November in a halfway house for sex offenders. House Minority Leader Vincent Candelora says nurses should not be sent into homes with multiple offenders living there.
If we're not going to address that issue, it's going to be very difficult to make our home health care aides safe.
Now, the focus has been on home health care workers because of Grayson's death back in November. But both nurses and healthcare providers say we also need extra protection in medical facilities. I'll tell you what they're asking for coming up at 5:30. For now, live from the Capitol, Mike Savino, NBC Connecticut News.